Hi, I'm Dave Mastovich of Mass Solutions. We work with Cucamonga Valley Medical Group to help them spread the word about the COVID-19 situation, not only in their region, but throughout the country. We have Dr. Rahmi Mowjood, the Chief Executive Officer at CVMG, and Dr. Kyle Smart, the Chief Medical Officer at CVMG, who spent a great deal of time over the years on vaccines and is going to give us an update now on the COVID-19 vaccine.
Thank you, Dave, and welcome everyone. Some exciting news as we talk about these COVID-19 vaccines, which we've been talking about since March or April. So two companies are about to launch vaccines in the United States. One is Pfizer, BioNTech, and the other is Moderna. Both of these vaccines are mRNA vaccines or messenger RNA vaccines. And that's an important detail because there's several strategies on how to create vaccines for COVID-19. And these are very specific because they revolve around the mRNA. So what is mRNA? This is a part of the virus, the genetic code of the virus, and the virus actually infects, all viruses infect humans and they take over human cells and they put the mRNA into the human cells to actually get the human cells to work for the virus. And so we're exposed to mRNA all the time from viruses. And in these vaccines, we're getting a very small piece of the genetic code, a small piece of the mRNA for actually the protein that helps COVID-19 attach to human cells called the spike protein. And so the technology is so amazing. They're taking a small part of this mRNA that I described before, and that's what the vaccine's about. And that's how it's priming our immune systems to COVID-19 by getting us ready for this attachment protein or the spike protein. So it's pretty amazing technology.
So what does this mean for all of you? So we know that there are multiple phases of the population to be able to get this vaccine. Both vaccines that Dr. Smart referred to will soon be made available, but the how, the logistics behind it, we still are not 100% sure of. CVMG has been working hard behind the scenes to make sure that we're in the position to be able to give this vaccine out when it becomes available to us. What we want from our patients is for you to reach out to us to see if you might meet the criteria of a fragile population that should get the vaccine in the very early first phase. We know that in that first phase, 1A and 1B, they're targeting frontline workers, healthcare workers, as well as the population in skilled nursing facilities and nursing homes. But also in phase 1 are people that have certain illnesses that could pose a great risk for them to develop bad symptoms if they do get the COVID-19 infection. If you think that you may be part of that population, please reach out to us, make an appointment. We can do a televisit or we can talk to you. Any of our providers at CVMG can help figure out whether or not you meet that criteria. And if so, then we can work on making sure that you get that vaccine whenever we find out how to deliver it when it becomes available. We wanted to make sure that everyone had an opportunity to hear from myself and Dr. Smart directly about both of these vaccines.
Dr. Smart, you talked about the logistics. I know a lot of people want to know about how long it's going to take to get to the first responders, the healthcare workers, those most vulnerable. I know you wouldn't be able to give an exact number, but can you educate us a little bit to get us a better understanding?
That's a great question, Dave. And like Dr. Mowjood said, the most high-risk people, including elderly with multiple medical problems and healthcare workers and first responders, they're gonna be at the top tier to get the vaccine first, and that could come before the end of the year, which is just a few weeks away. For the rest of the public and for that to happen, I think we're looking at spring to summer of 2021. So it is closer than we thought, and they're really working hard to meet a timeline and curb the pandemic.
And to that point, I think it's important for everyone to realize that since we're looking at spring and summer, to continue to be smart, wear a mask, socially distance as best as you can, keep your hands clean, and to ride this out to allow the vaccine to be able to be made available to everyone. I think it's important also to mention that both the Pfizer BioNTech vaccine and the Moderna vaccine are two-shot vaccines. The Pfizer BioNTech vaccine is a two-shot vaccine that is given the first shot, and then 21 days later, you will get the second shot. Whereas the Moderna vaccine is given with the first shot, and then 28 days later, you will get the second shot.
As always, thank you both for the valuable information. Dr. Rahmi Mowjood, Chief Executive Officer, Cucamonga Valley Medical Group. Dr. Carlos Smart, Chief Medical Officer at Cucamonga Valley Medical Group. Thanks again, and more videos to come.